And welcome back. Time for Opinion Court. We'd love to hear from you. Please do get in touch with us. 22422 is our SMS line. And of course, if you're online, please use the hashtag Opinion Court, whether that's on Facebook or Twitter. It allows us to track your conversation. I will reintroduce my guests to you. To my left is government spokesperson Eric Kiwaibe. To my right is Jeremiah Maina, the CEO of the National Nurses Association of Kenya. And next to him is, of course, Edward Kisiangani, our resident political analyst. Gentlemen, before we speak, let's start by taking a look at pictures that exemplify the state across the country. These pictures are hard and very difficult for us to air. They're difficult to watch, but they're important, gentlemen, because that is what we're actually talking about. Those are the lives that are at stake as posturing continues on both sides. And so despite the fact that we've seen so much suffering in 4 days, Jeremiah, there's no deal in sight. Your own talks, the nurses' talks with government also failed to reach a conclusion this evening. From your end, what is the main obstacle in the talks?
I think it's just honesty in terms of moving this country forward. And I would say that all of us, we are bound by the Constitution. And over time, we have disobeyed the very Constitution that us as Kenyan gave it to ourselves. And I would be talking on Article 10 only, because we must be honest in any discussion. This is not a crisis that came yesterday. It's a crisis we started the journey in 2013. If you check on the Article 187, it was very clear that when we are devolving, we devolve with the resources. And that is when we got lost, because we did a political game and we devolved and we said health is devolved. We never allocated the resources. So the journey has been climbing up and about. On the side of the unions, they've disrespected the counties. The national government also disrespected the counties. We are still finding Abiy House controlling the counties, and that is where we are getting the crisis. I've never understood why a doctor or a nurse would work for 30 days and yet then have to go on strike because there's a salary delay. Who pays who? It's not the county. We have a consolidated fund that every Kenyan taxpayer is paying to. So I have legitimate expectation that if I'm a public officer, I work within the 30 days, I'll be paid. The other issue we have seen is this harmonization. You'll find Kiambu is promoting its people. We see Nyeri is not promoting. We have standard uniform of public service. So basically, this is I would say, and this is what I said, it's something that we have created on our own, disobeying the Constitution either way, and we need to sit down honestly. There is no money we are going to get out. The money is within the budget.
All right, so yes. you believe there's dishonesty on the part of government, particularly in the allocation of resources to counties, and then how counties prioritize that in terms of healthcare. Yes. What do you think the challenge in negotiations has been for government?
Well, what I would tell you tonight, and what I would want the gentleman here to understand, and what I would want to tell Kenyans, is that from day one, the government is not interested in technicalities. There is a lot of things we can say about the CBA, that 80% of the health sector went to the counties. The counties were not part of that CBA. You know, the government had an old recognition agreement. We can say that there is even a court order saying that the issues around that CBA should be solved with a deadline of January. We can say a lot of things. But what the government is saying is that we are prepared to bend over backwards to get Kenyans treated. those people who are sick, those people who have had accidents, what they need tonight is healthcare. And if you are out there, and that is why today I'll be listening to this gentleman. I am listening on behalf of the government. The rest of the government is listening to a solution so that tonight and the day after, we have the people who are sick being attended to.
If you were willing to bend over backwards, then it suffices to argue then we would not be in a stalemate. What proposals has government put on the table in the course of the start-stop talks that we've seen over the last few days?
What has happened is that if you know the issue with the doctors, it's about a CBA which has not actually gone through the full circle because the SRC and the Treasury are yet to put in their contribution. And even the doctors know that. But in spite of that, the government has moved the gross salary of, has agreed to move the gross salary of the lowest paid doctor from about 150,000 to 180. And I can tell you that even the market
from the 300% that was agreed on with the CBA.
Of course, that CBA cannot be treated as an agreement. It is not registered, but we have forgotten about those technicalities. When they go to 180, they will be right at the middle of the market rate, because the best paying hospitals, private hospitals in Kenya, and you know the government has so many other advantages, permanent and pensionable and all that, but we don't want to go to that. We shall be, they are starting from around 140, 145 all the way to about 220. So at 180, the government will be stuck in the average of the market. And the government has not considered anything to say, gentlemen and ladies, we can offer this. After looking at what the Treasury can do, of course we have limited resources. You can see what teachers are asking, what policemen are asking, what security is asking, but the government is ready to meet at the middle ground to ensure that this has been done. And let me say something for the governors. For the first time we have seen county governments, their chairman has been here throughout, along with his two governors and their technical staff, to say that the issues we have, whichever they are, whether they are pending in court or wherever, these issues are solvable. We don't need one more Kenyan to die to prove anything.
He says that the government is willing to meet at the middle point in that, is it about a 50,000 shilling or so pay rise is middle point. Are you hell-bent on ensuring that the CBA that was struck in 2013, the 300% pay hike, is implemented as is, or is there room to negotiate that downwards?
I think this is where we are getting wrong, because they are only creating another crisis. They are talking about doctors. We have 20 health professionals. So are we going to be dealing with piecemeal reforms? I think the government promised a public sector reform for every public officer. That is one thing. The other issue that we need to look at is not only the doctors on strike. We have nurses, but we also have a bulk of other health workers who are silent. And one of the crises that we are getting today is because before devolution, the county, the municipal council, we had the union signed a CBA that gave a lot of money. So when these people were being devolved, they were devolved with a CBA that had a higher increment. And these unions are still there. So are we going to be dealing with piecemeal? This is why the Constitution has SRC. And we need to open up and say, this is what we can afford as Kenyan, so that if it is, I'm being told to pay more, so that a nurse can earn better, and no Kenyan die, that it's be known.
So what exactly is it that...
No, let me make a correction.
Hold on, let me respond. Okay. So what exactly is it that you would want addressed?
What we'd like to address,
so that the patient we have seen there is attended to tonight.
Yes.
That is the interest of the government. The other issues, we shall deal with them. Do not forget that this strike is an immediate knee-jerk response to what the SRC presented less than a month ago.
Let's listen to, so what would you want?
So what we would want is, as this was saying, an honest discussion. We have the budget.
What are your terms?
What our terms is very clear. We don't want proposals that we shall also end up with another strike. We want clear proposals that is put in the budget. It is black and white for every Kenyan, so that at least if I'm going back tomorrow to work, I know very well that this money is there.
That still sounds very vague. What are your specifics? You're saying we will return to work if we are paid how much?
I'm saying it is clear in terms of, because he has said very well, in terms of CBA, they are not discussing. So we have disparities. Like I've said, like promotions. We have counties that have promoted, the others have not. So that it means there is money right now. So can all the counties promote all the nurses, all the health workers, because that money is in this financial year? So once that is done and it's clear, then we can go to the other issue. Now he's talking, let us open SLC and see what is this secret SLC is putting in black and white figures, because it has brought birds that, but we don't know inside that how much is going to earn. So that once we discuss that, we shall not have a crisis in June when I'm being told a nurse is earning, has been added 10,000.
So if I was to restrict myself purely to what nurses want, then first you would need to be recognized, your association would need to be recognized by all counties.
Yes.
So that is a demand.
That is a demand.
And what has the Council of Governors said about that?
I'm glad that they have come up with a standard recognition agreement. They are ready to sign, and the only challenges that we are having is right now we are having issues as the union. We don't have structures, but it is possible that they are ready to sign that.
But you have structures to call off a strike.
I think maybe let's not go into technicalities of whether it's legal, because the government spokesman is talking as if, from my interpretation, maybe this strike is illegal because it has to satisfy the legal provisions. Maybe there was no CBA. Let's assume that is the position for purposes of this discussion. There is, whichever way you look at it, there is a crisis, and the crisis is that doctors are on strike. So how do we navigate out of it? Those heart-breaking images are bad, but the whole thing has been turned into a comedy, because even policemen have been used to tear gas doctors in the streets. And I'm sure when they get injured, the same doctors will try to treat them. Maybe they will not look for us. I'm sure professionally, even when those doctors are on strike, they'll have to treat the police officers if they get injured. So let's not go there. The problem that we have here is the way it's bigger than even the doctors themselves. I have always argued that we need to restructure this economy. Every time you hear the politicians talk, the political rhetoric in this country, it's a rhetoric that ignores restructuring. Whether you are talking about the Jubilee or Code, they are desperate to tell you they want to govern, but you don't know why they want to govern. And yet, we need to restructure this economy to get to the point where we actually know where we should put our money. This has not been done. It should be done in a bigger context than what we are doing. I've never seen people who can, pride themselves in an economy that trains doctors, it can't employ or even pay. I've never. So when you look at this, look at the number of doctors we are talking about. They are less than 4,000 in the entire country. So how much does it take to pay them? Is it completely unexpected that the government was not foreseeing this one coming? From 2013, the public has heard about it. So what is really important is for us to sit down and say, where do we put money? He has talked about public sector reforms in a holistic manner, but you are talking about the little resources we have. There is a lot of money in Kenya which is being stolen. So much is being stolen every day you read the papers, but there's no money to pay doctors. There is no money to pay teachers. There is no money to pay medical staff. Even there is no money to pay policemen who put their life on the line to help us get out. But there is a lot of money to be stolen to pay MCS, to pay members of parliament, using their own seats to fight each other in order to protect corruption at City Hall and other places. That money is available. But there's no money to pay 4,000 critical mass of workers who should help save lives. So therefore, time has come. The political elite is not doing it. But for us, the conversation should move over to a point where we now start discussing who should take taxpayers' money in this country. We all pay taxes, but for what? We pay taxes for important services that we cannot provide ourselves without that money. So this money must pay certain people. And then we should not punish and tell everybody that, look, the way to become rich in this country is to join politics, so that we attract doctors to become politicians, we attract administrators to become politicians in order to get the money. So that is the direction that we need to do. The conversation should be rather holistic than just focusing on this problem.
It's a bigger problem. But the immediate need is in hospitals where you know, families are now being forced to take their people home because there's nobody to attend to them. So I want to return to you and ask you, what would it take for you, for nurses specifically, to return back to work? You've said, one, let counties recognize your union. Secondly, in as far
let us promotions be done across the board.
Be done across the board.
Tomorrow, right together. And we have seen the CS Treasury asking for 30 billion and saying you want to make loads. I want to talk with the professor. What was he saying? That money can immediately be put to pay doctors and nurses and health workers. That is clear, because it means there is money that the parliament is being told, can you approve for last for expenditure? If it is, that means there is money.
The money is there.
So why don't we put, and that we start enjoying?
Is there any other thing that would be a necessity for you to return to work?
The other necessity that I would say is honest commitment, progressive, so that we have legitimate expectation. We don't want a situation where, like now, if you see the counties are issuing circulars that there will be delay in December salaries. Why is it only in health? I think there is a bigger political game we are getting into. Because when money is devolved, I don't expect that it is separated, that this is for health workers, and health workers must, the salary must delay every month.
So if you're paid, I want to get this right, if you're paid on time,
we are paid on time,
your salaries are harmonized and your union is recognized, then doctors are ready to be back to work tomorrow. And nurses, I beg your pardon, nurses are ready to be back to work tomorrow. Is government in a position to isolate the nurses' case, the doctors' case separately, and move forward in that way?
The issues for both are very different. And I dare say that these people are going on strike because they can go on strike. The issue with the doctors, the key issue with the doctors which they have put in the table, is that CBA which has not gone the full hog even in court. And the underlying factor is a notion that doctors are poorly paid. I am not sure for somebody who is leaving university today, 140,000 is a poor pay. I'm not sure, because when I think about his principal in high school, by the time the teacher who taught him in high school reaches there, how long will he have worked?
But the university teacher, on the doctor's question,
let me proceed.
Finish the nurses. Let's talk about nurses specifically.
The doctor's question, I think the government, His Excellency the President himself said, forget about those technicalities. Treasury, Ministry of Health, Council of Governors, sit down and get a formula first. Then other issues which must go on will go on. Because
you mean a return to work formula?
Yes, get a return to work formula.
Which they have said they do not want.
With nurses is even more complicated, because the only people who have a recognition agreement with the nurses is the national government. The other 48 governments have worked on a formula, the standard recognition agreement, whereby they are now going to get into the agreement. After it has been signed, each side will then get 3 members so that they sit down and negotiate and come up with a CBA, which is supposed to be registered so that it will have the force, so that it can be executable. Those are the technicalities. And the government, because of the concern of the national government, that is why we have all come together with the county governments so that these things can be expedited.
When do you reasonably believe that can be done?
Actually, a lot of it has been taking place. I think you can confirm how many counties have complied so far, but I have not had any county. For once, there is no governor who has said we shall not
only
sign it.
46 have signed.
But my brother, you remember that there's a question you need to address.
Let me finish.
Yes.
And then there is another thing. I have not been involved in promotion of others, but I've been involved in promotion of police officers. When you say that all nurses should be promoted, I don't know what system they use, but I think promotion should be a subject which is a little bit more serious, and no union whatsoever should promise anybody an immediate and a direct promotion. I think as a professional, I also hold a master's degree in business administration with a lot of bias in human resource, and I would tell you that when you promise, it becomes very good. Another thing I would want to take us back a little bit, allow me to do that. Why did we get an SRC in this country? It is because the international best practice, which America has adopted, countries like Japan has adopted, is to set up a salaries and remuneration commission of sorts, or a body which measures work, the products, and determines these are the limits. And then we all fall there. But then unfortunately, when we were writing the new constitution, even professionals did not take time to see what is our part in it. Everybody said, kama kiongozi wa chama yangu, who happens to be a tribal kingpin, has read the constitution, iko sawa sawa.
You seem to be going back to the same technicalities you're not interested in. But
let me get this, and I can seek your indulgence.
No,
what did you want me to address?
I wanted you to address in what reasonable period government can put the proposals that nurses have asked for on the table so that we can get them back to work.
These proposals have been on the table, and by the way, I hope tomorrow we shall reach a conclusion.
You see, Anne, government spokesman has ignored a couple of things. You know, this strike, from my own reading, whether it's illegal or illegal,
raise them, I will answer them, Professor.
It is not about salaries. What we are saying is, from what I have, the literature I have, the agreement that the doctors seem to have entered with government was that we need to increase the number of doctors we have. Employment, we want to employ more, because the ratio of doctor to patient is roughly about 1 to 16,000. Now, if you look at that against the population of 42 million people, you end up, there is no doctor who can do that. Now, it can accommodate, right now it means about 2,765 doctors are looking after a population of 42 million people, which is not acceptable. So let's talk about one side, the remuneration, and another side, the other demands the doctors are making, that they work under appalling conditions in some hospitals, there's no equipment, and they also want to increase manpower so that they can serve the public well. Nobody's talking about this. And it requires money too, I know, but why are we not talking about it? So that you look at, let me just finish because I have another one. You are looking at it as if these people are just looking for salaries. Now, the second thing that you really need to look at this, at the whole thing of doctors, is that the doctors started talking about this thing for a long time ago. Now, in technicalities, one of the things that you are mentioning is this SRC. This SRC, the time has come also for this country to re-interrogate its role. First of all, the SRC, if you read the Constitution very well, it does illegal things. The way the Constitution established SRC was this: the Salaries Remuneration Commission was not even supposed to engage workers in this country. The Constitution said it proposes things, I mean, salaries and allowances to the employer, and it's up to the employer to take them or not. Today, the SRC sits on the table trying to negotiate and joining government. So there is a growing concern in government that, in fact, SRC is playing the role of government. It's being used as a tool of frustration, where whenever government does not meet its obligations, it employs SRC. But the SRC, their role is challengeable in the court of law.
Prof, because we must wind up, and we began this program with the images of Kenyan suffering, and
yes.
the question that I've posed to both sides is, what would it take to have, in the shortest time possible, yourselves back to work? It seems to be a winding one with no hope of an end in sight. So to you, sir, as I wind up, will you be supporting the move that we've had, the very latest now, for private workers in private hospitals, medical staff in private hospitals as consultants, arguably other technicians, etc., to pull out as well of private hospitals, pulling out of emergency care? Is that something that nurses agree to?
I want just to say...
That's a yes or no question, sir.
Of course it is going... Yes.
You agree to it?
Yes. And I would say I said this is government issue that need to be addressed. I want to talk about nurses. The moment we started in 2003, it's the same government that destroyed the negotiating team, changed the union officials, and up to today we have never had a stable union. It is government that did that. We have been in court in and out. So basically what we are being treated into, it is a government initiated process. We could have done, the AG gave us on 4th of June 2014 and said go and negotiate with the counties. In August that year, the government had changed the union officials, and right now what we are seeing is there is no negotiation, and this strike is coming in because we are expecting a ruling next week.
No. Anna is asking this question. Anna is asking a very important question. It's not that.
Yes.
Let's not talk about the technicalities, because I think Anna's frustration is that people are dying, and therefore something must be done. So I have this solution. President Uhuru Kenyatta, please call the doctors and talk to them and promise them what they will do, discuss, and tomorrow sort out this matter so that our people are treated. And
would you prefer to negotiate with the president?
Directly.
Tomorrow, yes.
Directly?
Yes. Tomorrow, and we sort it out.
There are so many middlemen in this, middlemen and women.
These middlemen are just killing Kenyans.
The president should
what do you say, finally, what do you say to Kenyans who are watching, who have a sick person at home, and are wondering what to do with them? Where to take them?
Two people. The president and the chairman, council of governors, sit tomorrow, we are sorted out.
That's what you tell the sick person?
Yes.
Yes. The president will sort it out.
The back stops with them?
He will say yes.
Not you?
Leadership. Leadership.
I thank you all for your time.
I can't believe it.